Okay, do I have your permission for the video?
Yes.
Okay, here's the paper. And now I'm going to do the 360 room scan. Okay. Okay. Okay, so now I'll start my assessment. I would start by introducing myself. My name is Jade and I'm a nursing student. I would wash my hands. I would use two patient identifiers, like name, Rachel Keefe, date of birth, 5/3/2000. And then I would explain that I'm going to be doing a head-to-toe assessment, and I would provide privacy and put on gloves if necessary. So first, I'm going to start by getting your medical history. Have you had any history of heart attacks?
No.
Congestive heart failure?
No.
No? Okay. So now I am going to show where I will place the stethoscope and how I would find that. So first, I would start with the aortic area. So I will locate the clavicle, find the first intercostal space, and move down to the second, and on the right sternal border. And then I would move over to the left sternal border, and on the second intercostal space would be the pulmonic. And then I would move down to the third intercostal border on the left, or intercostal space on the left sternal border for Erb's point. And then I would move down to the fourth intercostal space, which would be the tricuspid area, and that would also be on the left sternal border. And then for the fifth spot, I would move to the fifth intercostal space, and it would be the mid-clavicle. The mid-clavicle area. So now I'm going to listen. Okay, so each of the spots sounded regular and strong. There appeared to be no murmurs. Usually we find those at Erb's point. And I heard S1 sounds at the aortic area and the pulmonic. So now I'm going to pick a spot and listen to the heart rate. Because it was regular, I'll listen for 30 seconds. Okay, so it was 44, so times 2 would be 88, and that is regular and within normal range, because the normal range is within 60 to 100 beats per minute. So now I will move on to your arms, and I'll be comparing them bilaterally. So now I'm going to be looking for some symmetry in the skin color. It's a beige color, and there are no skin variations. and there appears to be no inflammation, no redness, no lesions. So then I would move on to the hand grafts. So I would ask my patient to pull on my fingers and document the strength. They are strong and equal bilaterally. So then I will move on to the legs. So could you lay down for me, please? And for the legs, I will be comparing them anteriorly, posteriorly, medial, and laterally. And so first I'm going to look at the skin, or the color, and any variations, and I do not appear to see any skin color variations, and the color is also a beige. And then I would check to make sure the skin is intact and symmetric, and then I would look at hair distribution, and my patient's legs are freshly, cleanly shaved, and her hair follicles appear to be evenly distributed bilaterally. And then I would move on to looking at the venous pattern and see, and there are no signs of venous patterning. And then I will look for primary, secondary, or vascular lesions, and there appears to be no lesions. But if I would find one, I would inspect the size, the shape, the distribution, and the location of the lesion. So now I'm going to palpate each leg for edema. So I will be doing this proximal to distal, all the way down to the toe. I'm also noting if the skin is moist, but it's not, it is dry, and there's no edema present. So now I'm going to do the temperature using my hand. And on the patient's left leg, it was warm and it got cooler as it went down to the toes, which is normal. And the same thing for the right leg, it was warm, and as I moved down to the toes, it got cooler. So now I'm going to do plantar flexion. So I'm going to use resistance, and you're going to push down. Okay, it is strong and equal. So now for dorsiflexion, you're going to push up. And same thing for dorsiflexion. It was strong and equal bilaterally. So now I'm going to move on to the pulse, posterior tibial. So I'm going to listen or feel. For each of the legs, it was regular and elastic, and I would give it a +2 for each. And now moving on to the dorsal pedalis pulse. And for each of those, it was strong, elastic, and I would give it a +2. And then I would look for any ulcerations on the legs and feet, looking at the heels, and I would look for any breaks in the skin, which I do not see. So after that, I would position my patient for comfort. I would put the side rails up ×2, place everything within reach, like the call light, and I would wash my hands, and I would document all my findings. That's it.